What is peak expiratory flow rate, PEFR, for asthma? Have you ever wondered how doctors measure the severity of asthma? One important tool they use is called Peak Expiratory Flow Rate, or PEFR. This measurement tells us how fast a person can exhale air from their lungs in one quick breath. To measure PEFR, a person uses a device known as a peak flow meter. This handheld tool is simple to use and provides valuable information about a person's lung function. When someone has asthma, their airways can become inflamed and narrowed. This can lower their PEFR, making it harder to breathe. Monitoring PEFR is essential for people with asthma. It helps detect when airways are becoming obstructed, often before symptoms like wheezing or shortness of breath appear. By catching these changes early, adjustments can be made to asthma treatment to prevent serious attacks. PEFR values can vary based on several factors, including age, sex, and height. Generally, adult males and taller individuals tend to have higher peak flow rates. For adults, normal PEFR values usually range from about 400 to 700 liters per minute. For children, the range is lower, typically between 150 and 450 liters per minute. To manage asthma effectively, individuals are encouraged to find their personal best PEFR. This is the highest reading recorded when asthma is well controlled over a period of 2 to 3 weeks. Establishing this baseline is key for interpreting daily PEFR readings. Asthma action plans often use this personal best to define zones that indicate asthma control levels. The green zone is when the PEFR is 80% or more of the personal best, showing good control. The yellow zone is when the PEFR is between 50 and 79%, signaling caution and possible worsening. The red zone is when the PEFR is below 50%, indicating a medical alert and the need for immediate action. To measure PEFR accurately, a person should take a deep breath to fill their lungs completely, then exhale as hard and fast as possible into the peak flow meter. This process is usually repeated 3 times, and the highest reading is recorded. Regular monitoring of PEFR using a peak flow meter is a straightforward and effective way to manage asthma. It helps both patients and healthcare providers assess lung function, adjust medications, and prevent severe asthma episodes by recognizing changes in airway obstruction early. In summary, peak expiratory flow rate is a key measurement for asthma. It quantifies how quickly air can be exhaled and reflects the status of the airways. Monitoring PEFR is essential for guiding treatment and maintaining control over asthma symptoms.